paper that I'll be using.
Come in.
So I've cleaned my equipment prior to arrival. Move the camera up just a little bit. Sanitize my hands. Hello, my name's Samara. I'm going to be your nurse today. Can you give me your first and your last name?
Luke Young,
And can you give me your date of birth?
9695.
Can you tell me what we're here for today?
Head to toe assessment.
And can you tell me where we're at?
Hospital.
Okay, so patient is alert and oriented to person, time, and place. He has good posture. He's maintaining eye contact with me. He doesn't smell funny. He has good hygiene. He's dressed appropriate for the weather outside. And he does not seem to be in any type of distress. So before we get started, have you been experiencing any type of pain?
Headaches.
And can you tell me when those headaches started occurring?
Probably a week ago.
Can you tell me where at or what location your head's hurting?
Behind my eyes.
Can you just describe the type of pain that you're feeling?
Throbbing.
And is there anything that you do that makes the pain worse?
Sunlight.
Is there anything that makes it better?
Ibuprofen.
And on a scale of 0 to 10, 0 being no pain, 10 being the worst pain there is, what would you rate your pain at right now?
4.
Okay, so do you need anything before we get started for the pain?
No thanks.
Okay, we're going to start with the temperature. The normal temperature is 96.7 to 98.6. This temperature is 98.1. It's within the normal limits. We're going to go ahead and get the blood pressure. Is there an arm that you prefer me to do this in?
This one's
Okay, so hold your arm out like that. We're going to palpate for the brachial artery. And the pulse is present. It's 2 plus normal rate, normal rhythm. I'm going to go ahead and put this on. Is that too tight?
No, ma'am.
So we're going to estimate for the systolic threshold. And we're going to palpate for the radial artery and pump until we no longer feel a pulse. Okay, so it's right at 100. We're going to let his arm rest for a second. This is when I would test for oxygen saturation levels. And I do not have a pulse ox, so we're going to pretend. And you would pick a warm, clean, dry finger. We're going to say his is at 97%. Normal is in between 95 to 100, so that looks good. We'll go ahead and get the blood pressure reading. Okay, so his blood pressure is 110/60. A normal blood pressure is 120/80. So that looks good. And now we're going to palpate for the radial artery and get his pulse. I'm going to count for 15 seconds and then multiply that by 4. Okay, so the pulse is present. It's 2 plus normal rate, normal rhythm. The pulse rate was at 60, and his respirations were at 16. Normal pulse is in between 60 to 100, and respirations 12 to 20. So everything's within the normal limits. So now we're going to go ahead and move on to the skin and hair, Nell's part of the assessment. So as I said earlier, he has good hygiene, so I don't feel like it's appropriate for me to wear gloves during this part of the assessment. Are there any lesions, pests, or open wounds that I need to know about
No,
before we
ma'am.
get started?
No, ma'am.
Okay, so visibly his hair is clean. It's brownish blonde. The hair is evenly distributed on both sides. There's no pests, no lesions, no nodules noted. Okay, so his skin color is white. There's no redness, no visible edema, and it's a good color for his ethnicity. The moisture is dry, so he has no moisture in his upper extremities. There's no moisture in the lower extremities. The upper extremities are warm, as are the lower extremities, and hair is evenly distributed through both legs bilaterally and both arms bilaterally with no lesions present. So we're going to assess for your skin turgor, and I'm just looking for any signs of dehydration, instant snapback, so no signs of dehydration noted. Okay, so now I'm going to look at your nail beds, so can I have your hand?
Yes, ma'am.
Okay, the nail beds are pink, the nails are clear, and there are no scarring or no lesions present on both hands. His capillary refill time is under 2 seconds, and that is bilaterally. Okay, so can you hold your hands up, make a heart with your fingers, just the 2 fingers. Bring your knuckles together, and then bring them in like this. Okay, so no signs of clubbing present, and patient shows no signs of hypoxemia. We're going to move on to the head and neck part of the assessment. So the head is midline to the body. It appears to be symmetrical. We're going to palpate for the temporal artery. That is 2+ bilaterally. Pulse rate is normal, and the rhythm is normal. And now we're going to palpate for the carotid artery. It's 2+. And 2+, normal rate, normal rhythm bilaterally. Okay, so now we're going to palpate for your sinuses. So let me know if you have any tenderness or pain. We have the frontal sinus, and we have the maxillary sinus. We're going to go ahead and palpate for the lymph nodes. So let me know if you have any tenderness or pain with that as well. Okay, we're going to start pre-auricular, post-auricular, occipital, cervical, and then the post-cervical chain, submental, submandibular, tonsicular, supraclavicular. Okay, so no lumps or no fixated nodules or lymph nodes. And there was no tenderness or pain, correct?
No, ma'am.
Okay, so next what we're going to do is assess for your masseter strength. So I want you to bite down, clench your jaws. Okay, and then open. Okay, and cranial nerve 5 is intact. Can you go ahead and smile for me? Frown, puff your cheeks. Cranial nerve 7 is intact as well. So moving on, the throat and the trachea is midline to his neck. Can you swallow for me? Cranial nerve 9 and 10 are intact. We're going to palpate for the thyroid. Okay, so his thyroid is slightly palpable. Upper lobes are symmetrical bilaterally, and lower lobes are symmetrical bilaterally. Can you go ahead and get a drink of water for me? Okay, and they move up and down when he is swallowing, so that's good. Okay, so we're moving on to the eye part of the assessment. I'm going to go ahead and clean my hands. I'm going to put on some gloves. As I'm looking at him, his eyes are not swollen, no signs of edema, there's no redness, and his eyes are not bulging. So his sclera is white and shiny, no signs of jaundice. His conjunctiva is pink and moist, there's no drainage from either eye. We're going to move on and do the 6 cardinal fields of gaze. So what I want you to do is focus on my pen without moving your head. Just follow it with your eyes, okay?
Okay.
Okay, so cranial nerves 3, 4, and 6 are intact. While I have the pen, I'm going to go ahead and assess for the corneal light reflex. So I'm going to have you stare at me so that I can get a direct look at your eyes. Okay, so the light is present on both eyes bilaterally and it is equal. So no signs of strabismus noted. And now what I'm going to do is test for the corneal light reflex. So same thing, just stare ahead at me. The pupils are dilated at 3 millimeters and they are constricting to a 2 millimeter bilaterally. And same on this side, they're both constricting bilaterally to a 2 millimeter. So now what we're going to do is look for your red light reflex, and we're just looking for any ocular tumors or fluid-filled cavities behind your eyes.
Ready?
Okay, so you can stare straight ahead. And the red light reflex is intact with both eyes. So I want you to hold this paper out elbows length like this and cover your opposite eye. Just like that, yep. And read whatever line makes you feel comfortable.
9, 3, 7, 8, 2, 8.
Okay, so that's 20/25 vision. Go ahead and switch hands.
Okay.
You can hold the paper up if you need to.
3, 7, 4, 2, 5, 8.
And that is 20/30 vision. And cranial nerves 2 are intact with the reading. Okay, so I'm going to remove my gloves. The pupils are equal, round, reactive to light, and accommodating. All cranial nerves were intact. We're going to sanitize our hands. And we're moving on to the ear part of the assessment. So as I'm looking at him, his ears are, there are no lesions, there's no redness. Have you had any pain or tenderness with them?
No, ma'am.
Okay. Just let me know as I'm filling them if there's any pain.
Will do.
Okay, so there are no lesions present. And he's not experiencing any kind of tenderness, so we're going to go ahead and take a look inside the ears. And you'll lift up and back. Okay, so the ear canal is slightly red. The hairs are intact. There's slight wax. The tympanic membrane is present and the cone of light is reflecting off of the tympanic membrane. Same with this ear. The ear canal is slightly red but looks a little bit more normal on this side. The tympanic membrane is present. It's gray and shiny and the cone of light is intact. The hairs are also intact and there's slight wax. Okay, so do you have any hearing aids or hearing problems that I need to know about before we do the hearing test?
No, ma'am.
Okay, so I'm going to put my hand over one of your ears and I'm going to whisper 3 words. I want you to repeat those back to me, okay?
Remote couch chair.
Good job.
Pillow, dog, lamp.
So cranial nerve 8 is intact. And we're done with the ear part of the assessment. We're going to go ahead and move on to the nose. The nose is midline. The nose seems symmetrical. The septum does not seem to be deviated. and we're gonna look inside. So go ahead and tilt your head back. The mucous membranes are pink, the hairs are intact, and there is no discharge from either nostril. So they look good, and like I said, the septum is not deviated. So can you go ahead and occlude one nostril for me? Breathe in, breathe out. Switch fingers. Okay, so slight congestion is noted, and we'll make sure to tell the physician that. Okay, so now what I'm going to do is have you close your eyes. I'm going to put something underneath of your nose, and I want you to describe the type of smell for me. Can you smell? Good job. So cranial nerve 1 is intact, and we are moving on to the mouth part of the assessment. I'm going to change my gloves so we don't cross-contaminate mucous membranes. We're going to sanitize our hands. And put on some gloves. So as I'm looking at him, his mouth and his lips are pink. They don't have any present lesions. And like I said, they're pink. There's no blue discoloration showing any signs of low oxygen levels. So we're going to go ahead and take a look inside the mouth. Can you open up for me? The tongue is pink and moist. There's no cracks, no bumps. The hard palate is intact, no lesions. The soft palate is intact, no lesions. Buccal areas are pink and moist with no lesions. Can you lift your tongue up for me? Okay, no lesions are present on the bottom of the tongue or any signs of mouth cancer. Go ahead and put your tongue down. Open your mouth.
It's locked.
What is? Oh. Okay, so your teeth have no cavities, and they look really well. So go ahead and say "ah" for me. Okay. So cranial nerves 9 and 10 are intact, and patient can, or his uvula moves when he says "ah." Okay, and the tonsils were not present, so did you have those removed?
Yes, I did.
And I'm guessing they were at a grade 4 when he was younger, which is why he had them removed. So we're going to move on. And I'm going to say 3 words. I want you to just repeat those back to me, okay? Light, tight, dynamite.
Light, tight, dynamite.
Cranial nerve 12 is intact. Okay, so now we're going to move on to the lungs and the thorax and back. So as I'm looking at my patient, his precordial area is nice and flat. So is his back. I would say the expansion is 1 to 2 in diameter. So he doesn't have a barrel chest, no signs of COPD. And we're going to go ahead and take a listen. So go ahead and breathe in and out of your mouth for me. Okay, so normal bronchial sounds on both sides. Okay, and now I'm going to have you turn around for me. And I'm just going to have you bend over just slightly with your, okay. Now breathe in and breathe out. Okay, normal bronchial sounds. You're going to breathe. Okay, so as I said, normal bronchial sounds, and then the rest of the sounds were normal vesicular sounds. And the right lobe has, or the right lung has 3 lobes. The left lung has 2 lobes, and they sound good and equal bilaterally. So you can go ahead and turn around for me. And I'm going to check your symmetric expansion. So if you can take one more deep breath for me. Okay, so my fingertips separate and his symmetric expansion is normal. Okay, so we're going to go ahead and take a listen to your heart. Okay, so we're going to the second intercostal space and we are assessing for the atrial valve. You don't have to breathe and listen into your heart. Okay, S1, S2 nodal, we're moving over to the second intercostal space on the left side, and this is the pulmonic valve. S1, S2 noted. Third intercostal space is the Erb's point. S1, S2 noted. Moving down to the fourth intercostal space, and this is the tricuspid valve. S1, S2 noted. We're going to move on, move your arm out for me, to the fifth intercostal space, and this is the mitral valve. We're going to listen to this for 1 minute. Okay. So the rate was normal and it was at 62 beats per minute. So now we're going to palpate and just make sure we can feel the pulse as well. This is the maximum impulse point, and it is fifth intercostal space, mid-clavicular line. Okay, and the pulse is present, 2+, normal rate, normal rhythm. So now we're going to be assessing for any signs of edema. And his chest had no signs of edema as I was listening, and his arms look to be normal. We have instant release, so grade 0 on upper extremities, and grade 0 on lower extremities. So those look good. And pulses. Sorry, I forgot to assess your pulses, so do you mind if I go ahead and do that?
No, ma'am, go ahead.
Okay, so we're going to be looking at the popliteal pulse. And it is present. They're 1+, they're kind of weak. We're going to move down to the posterior tibial, and that's inside of the ankle. And those are 2+, they're a little bit stronger. And then the dorsalis pedis, which is right above the big toe, on the dorsal part of the foot. And those are 2+, normal rate, normal rhythm within all of the pulses. So, okay, now we're going to go ahead and move on to the abdomen part of the assessment. Are you okay if I expose your stomach?
No, that's fine.
Okay, you can go ahead and take the pillow and lay down.
Okay.
Okay, so as I'm looking at him, his chest and his stomach rises and falls evenly. He has no pulsating pulses within his abdomen, so that's good. There's hair present, no visible scars. So we're going to go ahead and listen. sounds are present in all 4 quadrants. We're going to go ahead and palpate. So just let me know if you have any tenderness or pain. Okay, so all 4 quadrants feel normal. There's no hard lumps or lesions. And now we're going to go ahead and percuss. And I hear tympanic sounds until I get to the rib. And we're going to go 2 fingers length below the rib. We're going to percuss. And I also hear a slight dull sound, so this would be the point of the liver. I'm going to have you take a deep breath in, and you're going to palpate for the liver. And breathe out. Okay, so his liver is palpable, but it doesn't seem to be enlarged. So that's it for that part. So you can put your shirt down, and we can sit up. We are moving on to the musculoskeletal part of the assessment. So I want you to show your shoulders. Okay. Cranial nerve 11 is intact. Can you nod your head yes? Nod your head no. Side to side. Okay. Arms out. Arms back like Superman. Together. And then out. In. Down. Okay. I'm going to have you lay down one more time. We're going to assess for range of motion on your legs.
Alrighty.
Okay, so bring this out, go ahead and bring it in, down, okay, and out, and in. That feels normal. Okay, go over here. There you go, out, and in, out to this side, back in, and that feels normal as well. You can go ahead and sit up, we can turn this way and we'll assess your range of motion on your feet.
Okay.
Okay, so if you can just move your feet up and down, and then side to side. So you can see. Side to side, up and down. Okay, and I'm going to go ahead and test your foot strength. So push down for me. Push up. Okay, so I would grade that 5 out of 5. And now I want you to put your fingers together. And you go ahead and try to pull apart. I'll grade that 5 out of 5 as well. And now we're going to be checking for the sensations. I want you to close your eyes. And I want you to tell me if you feel a soft feeling or soft or dull. Soft, dull, or sharp. I'm sorry.
Soft, dull, sharp.
Okay. Ready?
Sharp. Dull. Soft. Sharp. Dull. Soft. Dull. Sharp. Soft. Soft. Dull.
Good job. So the patient's sensations are flow and intact. I'm going to have you turn around. We're going to palpate your vertebrae. So we're going to start with the cervical vertebrae. Go ahead and lean down for me. Bend over. Okay, so the cervical vertebrae. And then we're going to go to C7. We're just going to palpate all the way down from the cervical vertebrae to the thoracic vertebrae. And then the lumbar vertebrae. And there are no curvature, so no scoliosis noted. Okay, you can go ahead and turn around for me. All right, so I want you to put your finger on your nose, and then I want you to touch my finger and return back to your nose. Okay, other finger. Okay, so the patient's mobility and balance seems well and intact. We're going to do one more test with that. So I want you to put one of your heels onto your other shin and slide it all the way down. Okay, other side. Right, so like I said, his mobility and his balance is well and intact. So that is it for our assessment today. Can I get you anything before I head out?
No, ma'am.
So I'm going to go ahead and clean my stethoscope. And clean my equipment, my ophthalmoscope and my otoscope. And sanitize my hands. Alrighty, Mr. Young, it was nice meeting you. Have a good day, and the call light is right there if you need anything. Thank you.